Hello, good evening to those who are joining today. We are having a live today with Dr. Lisa Stradiotto from Apricity Fertility Clinic, talking all about egg freezing, on egg freezing 101. So understanding when egg freezing might be a good idea, who it might be suitable for, and also the process. She will kindly be answering all of your questions, so have your questions at the ready. Of course, this has been in the media a lot, with Jennifer Aniston recently sharing her thoughts around it and her own story around wishing that she had more information about egg freezing and knew that this opportunity existed. So let me get Apricity here. Welcome. Please could you tell everyone a little bit more about yourself and the work that you're doing and the support you're giving at Apricity?
My name is Lisa Stradiotto. I'm by training an obstetrician and gynecologist. I then specialized in fertility and started working with Apricity about 2 years ago as a fertility specialist. I have special interests in recurrent miscarriage and egg donation as fertility issues, and then also, of course, general subfertility.
And today we're going to be, thank you for that. Today we're going to be talking about egg freezing. Obviously, there's been a lot in the press over the last couple of weeks with Jennifer Aniston sharing her personal story, fertility story, and saying that, you know, she wishes that she'd known what her options were in terms of freezing her eggs. What is your thought around that in terms of celebrities raising the profile on things like egg freezing? And do you think that people bringing that to other people's attention is helpful, sort of saying, I feel that I missed the boat on that?
Yeah, I actually think it's super helpful. First of all, it's very and I think that's brilliant. And I think a lot of what her message is that if she had known, she may have done something differently. And that's quite, I think, a profound message, because for many women, either they weren't aware of the option to freeze their eggs when they had the chance. You know, I think in life we often regret the things that we don't do more than the things that we do. You know, freezing one's eggs, it's very important to remember that it's not a guarantee, but it does just keep a few more avenues open, a few more options open. So, and hopefully, what I always say to my patients is, hopefully you won't need to use the eggs that you've frozen. But if in the future you do have fertility problems, or say you've had one child that you've conceived naturally and you're trying for a sibling, and now you're 42 and it's much more difficult, you know, then having frozen eggs it gives you more options at a later stage in life.
Definitely. And so for people listening, could you explain why people freeze eggs?
Yeah, so people have many reasons for freezing eggs. Historically, we started egg freezing is as a solution for women having cancer treatment, because chemotherapy and radiotherapy damages the ovaries. And so this was an option for women who were young, having cancer treatment, and they wanted to have a family at some point. They've just been given this awful diagnosis of cancer. And so it's a way to preserve fertility for when they want to have children, so that they could have their cancer treatment now, and then when they were ready to have a family later, that would be an option for them. So, and that's why it's called fertility preservation, preserving one's fertility whilst you have the chance. So, and then this was extrapolated into social egg freezing. People who would delay fertility, delay having a family for whatever reason, whether this was related to a career, a lifestyle, not having met the right person, And so it just gives one the option to do this later. Another group of people that we see wanting to freeze their eggs is people undergoing gender reassignment. So before starting hormone therapy and surgery for gender reassignment, this gives these people an option to freeze their eggs if they want to have children with their own gametes at a later stage.
What about people who suffer from endometriosis, PCOS, conditions like that?
Yeah, definitely. So this is a group of people where we expect them to have fertility problems in the future, okay? Because there are lots of couples who have unexpected fertility, but this is a subgroup where often it's more difficult to conceive. So this is a really good group of people who one would encourage egg freezing because they are more likely to have problems in the future.
Okay. And could you just tell us a little bit about the egg freezing process and how Apricity support people who are going through it?
Yeah. So
Or thinking about it.
yeah. So how the process works is initially one would have a consultation with one of our fertility specialists. We are all gynecologists who've specialized in fertility. So at this initial consultation, the doctor would take a detailed history, find out if you had any other underlying conditions that need to be borne in mind, if one was on any medication that needed to be stopped that might affect the process. It would also be, there would be some investigations that would be necessary, so blood tests and an ultrasound scan, because this gives us an idea of what one's egg reserve is like. And all women have different egg reserves at different ages, at different stages of their lives. Unlike men who can make new sperm every 3 months, women are born with all their eggs, with a complement of eggs, which we use up during our lifetime.
Which not everyone knows, do they?
No. And this is why egg reserve testing is so important. Of course, then by the stage one reaches it, for most people, when they reach their late 40s, their eggs are used up and then they go through menopause at about between the ages of 48 to 52. But we do know that egg quality declines over the age of 35. So just going back to the process, it would involve an initial consultation with one of our consultants to assess egg reserve. And then after that, if you decided that this was right for you and you wanted to go ahead with treatment, this would then we'd decide on a protocol and a dose for medication. The whole process usually starts with the beginning of one's period, and it takes about 2 weeks, sometimes 2.5 up to 3 weeks, but not much longer. Those 2 weeks are quite intensive. They involve daily injections and ultrasound scans to monitor the progress. Usually it's 3 scans a week. Okay, so you don't need to stop working or take annual leave during that time, but it is better if it's a quieter time at work. Okay, and then after the 2 weeks, there's a little procedure called an egg collection. This is a small operation where we don't make any cuts on the belly, but we just go with a tiny needle, which we attach to an ultrasound probe through the vagina into the ovaries and collect the eggs. This is done usually under sedation, which is a little drip in your arm that administers some medication so that one doesn't feel pain. Most people feel sleepy and you don't remember what's happened. And then when you wake up, we let you know how many eggs you've got.
Do you see a lot of people coming to Apricity for egg freezing? Is it something that has risen since COVID?
Yes, definitely. You know, I think COVID was a little bit of a lesson for many of us. We had time to think and reflect on things, and particularly people who were single, who had a very active social life. Maybe they thought, oh well, you know, it's not going to be like this forever. one day I'll want a family, and perhaps I don't know. I'm just thinking, maybe that's what kind of prompted
Read
people
that.
to think that
Mhm.
at one point, if I do want a family, how could I go about this?
If anyone has any questions for Dr. Stradiotto whilst we're talking, or any thoughts around egg freezing and COVID, as we've just mentioned, then please do feel free to ask. It's so kind that you're here tonight. Is it better? Sorry, my next question was, what happens if you don't have a partner?
Okay, so you don't need a partner to freeze your eggs. And in fact, this is a reason why many women do egg freezing. And then this is, a question that's often asked is, well, should I freeze my eggs or embryos? Okay.
Yes.
And embryos are what's created once the egg has been fertilized. So the egg is fertilized by the sperm, and then we call this an embryo. An embryo is further on along the stage of development, so it makes it this. We know that it's because it's further on in its stage of development, it's more likely to be more successful. However, creating embryos really limits your one's options, whereas freezing eggs gives one more autonomy and more options, because if you have a partner that you freeze embryos with, then you wouldn't be able to use those embryos without that person's consent. So if the relationship broke up, you wouldn't be able to use those embryos. And then if one were to use donor sperm, then of course those embryos are with the donor sperm, and if you met somebody later on who you wanted to have children with, that it would take away that option. So really, egg freezing is, yes, the success rates are lower because more numbers are needed, okay, but it gives women more autonomy, more choices, more future options.
So if, for example, you had 12 eggs collected, how many of those would you hope could potentially lead to a live birth?
Okay, so that's a really good question. And I'll answer it directly in a minute, but first I just want to take a step back because the literature says that we probably need, in women under the age of 35, the success rate is about 6% per egg, okay, or overall a 20 to 30% chance of success. All right. Now, what this means is that you probably need somewhere between 15 to 20 eggs to give one an 80% chance of having a baby.
Right.
So, and this is, that sounds like a lot, 15 to 20 eggs just for an 80% chance of one baby. All right. And this data is in women under the age of 35. That's also important to remember. Having said that, to go back to your question, if you had 12 eggs, you've probably got a good chance of having a baby, because if we were able to freeze 12 eggs, we when we thaw them, we have very good success rates with thawing. It's over 90%. Okay, so say we thawed all 12 eggs and 10 or 11 of them survive. Okay, then we fertilize the eggs. This is presuming that the sperm is normal. All right, it might be that your partner has abnormal sperm, and so the fertilization rate would be lower. All right, but presuming the sperm is normal, we expect around a 70 to 80% fertilization rate. So that means you've got 7 or 8 eggs that fertilize, so 7 or 8 embryos. Okay, then we grow the little embryos in the lab until day 3, and then until day 5. So if 8 fertilized, on day 3 you might have 5 or 6, and on day 5 you might have 4. Okay, some people might be lucky and they might have 5 or 6. Other people might be less lucky, and lucky, I mean, there might be something else going on that we haven't either appreciated or drawn into the equation. So some people might have 4 embryos and other people might only have 1 or 2. Okay, so, and that's from 12 eggs. So that's, and then we might transfer one of those embryos and the person is fortunate and goes on to fall pregnant, or it might not work. And then you need to do another embryo transfer. So that's why really, if one is able to get 15 to 20 eggs, that gives you a reasonable chance of having one baby. You might be able to have more from that cycle. You might not have any. Yeah.
Interesting. That's really good to know.
Yeah,
Again,
there's a big drop. So just to appreciate that there's a big drop off, you know, and it's impossible to guarantee how things are going to go. Okay.
If anyone has any questions, please feel free to ask. And if you don't want to ask publicly, feel free to DM us and we can put you in touch with the wonderful team at Apricity. We've linked up your details in our bio, so please do reach out to the team. Whatever stage you're at with your journey or looking into details, they'd be very happy to help. Today is about egg freezing 101, but of course you support people with any kind of fertility treatment need, testing, whatever it might be, IVF. And what happens if someone thinks that they might be too old to freeze their eggs? What would you advise in that situation?
Okay, so firstly, this is a very personalized question. So generally, I would advise egg freezing below the age of 38. Okay. However, it's from one's 20s to in 30s is the ideal time to freeze eggs. Definitely, if someone's been through the menopause, then it's not possible to freeze eggs. That definitely is too old. Then other options such as egg donation would be an option. But it depends on a person's lifestyle and the number of eggs, so their AMH and antral follicle count. And it's something that could be discussed at an initial consultation. It's really specific to the person.
Great. That's really useful to know. Thank you. How long can eggs be frozen for? Because I know legalities have changed around this.
Yeah. So up until recently, for social egg freezing, the limit was 10 years, but this has just been extended to 55 years. So yeah, you've got 55 years to use those eggs. Hopefully it won't take that long.
Absolutely. And any pros or cons or risks that you hear people talk about or ask you about that you think would be worth mentioning?
Yeah. So obviously the pros is that it's a little bit of a reassurance, not a guarantee, not insurance policy, but a little bit of reassurance, possibly options for future. Okay. Cons, really, there are very few downsides. Obviously, financially, one needs to consider, is this, are you able to afford going through the process of... and
I guess to that point, it's kind of how many cycles might be, enough to have enough eggs to make this a possibility.
Yeah. And that's where we could have a more tailored discussion with regards to a woman's specific AMH and how many cycles they might need. Most women need 2 to 3 cycles to achieve 15 to 20 eggs. Okay.
Do you tend to do those back to back?
I prefer to do them with a little break in between, but it is possible to do it back to back.
Is that because you prefer the body to be able to recover in between cycles? Yes. Does it depend on someone's AMH as well?
No, it really depends. It gives the body a chance to recover in between. There have been studies done on the yield from comparing back-to-back cycles versus having a break in between. The numbers are similar, possibly a little bit higher when there's a break between.
Interesting. And does that length of break depend on the personal situation of the person that you're treating?
So if, for example, you have a very high AMH and you're at risk of OHSS, right? Hormone levels are very high. Your ovaries physically, you feel big, you feel heavy, and it takes a while for everything to settle. Okay. Whereas if you have a really low AMH, you might be quicker to recover. So, and then to answer the question about risks, the main risks are there's a surgical risk, which the surgeon would go through with you on the day of egg collection. These are things like serious risks. There's less than a 1 in 1,000 chance of having a serious risk, which is injury to the surrounding structures in the pelvis. Okay. And then the risk of OHSS. This stands for ovarian hyperstimulation syndrome. And this is something in the fertility world that we used to be very scared of. However, we now have an injection, a trigger shot, which can virtually prevent OHSS. However, even using that, one does still have a 1 to 2% chance of OHSS, and the higher the AMH, the higher the risk of OHSS. However, it is something that we're very aware of. We're very careful to avoid it, and we take necessary steps to prevent this happening.
You mentioned work, and I think that's a really good point. For someone who's contemplating or looking into egg freezing, how much time might they need to take off work?
So the actual treatment cycle lasts about 2 weeks. Okay. The first week, one usually needs 3 scan appointments. They're generally done on a Monday, Wednesday, Friday in the morning. So that's a scan appointment and a blood test. Where Apricity do have a model where you can have at-home scanning, but it is more difficult to arrange. And then we've got clinics all over the UK where, and even if it's not actually a fertility clinic, we can refer you to an ultrasound centre that we have partnerships with to have scans. So it's usually 3 appointments a week. So you need, say, half a morning off 3 times a week for 2 weeks, and then one would need the day of the egg collection and maybe a day or 2 afterwards for recovery. So it is possible to work in between. However, of course, we don't know the effect that stress has on our bodies. It's better to, certainly one couldn't be traveling because we can never be sure when the actual egg collection will be. It's a fluid process, so we make the decision based on your last scan and how the follicles grow. Some follicles in some women grow quicker than in others, but generally it's about 2 weeks. So 2 weeks of appointments with an egg collection, the little operation at the end.
And do you find that most patients recover pretty quickly after the egg collection in terms of discomfort?
Yeah. Most people have a little bit of discomfort on the day of the surgery, but we give good analgesia, and then the next day some people are a little bit tender, but usually by about day 3 most people are absolutely fine.
This has all been fantastic. Thank you so much for your time this evening. Is there anything else you think it would be worth people knowing? And as I said, please do head to our link in bio to speak to the wonderful team at Apricity, who will give you and can speak to you about personalised care, consultations, etc., to really understand your needs and what might be the best opportunity and way forward for what you're looking for at whatever stage of your journey. But why do people tend to do egg freezing in the UK and with Apricity? May have lost a bit of connection here. Oh, can people still hear me? Let me know if you can see and hear me. I think the internet may have gone the other end. Hello? Could someone let me know if they can see me and hear me? It's reconnecting. Hello. Thank you everyone for joining this evening. Great to have that conversation with Apricity. Please head to our link in bio, speak to their wonderful team. They'd love to help you on a personal level with a consultation and for a customized treatment plan, egg freezing, any other fertility treatment option that you might be looking to explore.